Flags don't hate, guns don't hate, symbols don't hate, people hate. We're often using symbolism to make us feel as though that we've solved the spiritual illness that ails us, and yet we haven't even scratched the surface.
Strong comments yesterday from Armstrong Williams on this program as the nation continues to mourn the murder of 9 black churchgoers in Charleston, South Carolina. The man at the center of the killings, Dylan Roof, confessed he murdered those 9, saying he wanted to start a race war. But a lot of pundits and experts are now saying, wait a minute, what about mental illness in this case? And that's why we call on this next expert panel. Joining us now, psychotherapist and director of the Renew Center of Florida, Dr. Lisa Palmer, and also with us, psychoanalyst Dr. Heath King. Our thanks to you both for spending some time here on Newsmax Prime. Lisa, mental illness or hatred and racism, and how can you tell the two apart?
I know, there's a lot going on here, but we kind of have to separate them out. I think that he has a lot of features of antisocial personality disorder, and we tend to see on SPECT scans that murderers have, their brains are different than normal people's brains, and typically we see underdeveloped prefrontal cortexes on murderers. So they tend to have poor problem-solving skills, less emotional regulation, less care about other people, which basically leads them to more violent behavior.
Heath, there's been a lot of talk about drugs dealing with mental problems, and I forget the terminology again. Is it psychotropic or?
Yes.
And you have detected some commonality in this case and some others going on.
Yes. When this first happened, I made a wager with a psychiatrist friend of mine that Dylan Roof was also on medication, psychotropic drugs. And I won a bet on that. Actually, he is a part of a long line of individuals. Now, the drugs don't actually cause the homicidal actions, but they can be a catalyst to bring an individual over the edge. So that Dylan Roof was on Suboxone. Holmes, who's being tried now, it was on Zoloft. 2 others, Krinkle and Michael Carneal, they were both on Ritalin. You know, there's a whole history of this going way back. So yes, it doesn't cause it, but it can bring a person over the edge, and that's what we're dealing with now, because drugs are too available to people throughout the nation.
And going back to my point before, that they can also affect the activity patterns and the blood flow in the brain, affecting the composition of the brain, as well as influencing how the person behaves and acts.
And it is not only the behavior of Dylan Roof. I think a lot of people are scratching their heads saying, wait a minute, he was on this medication, and yet his dad bought a gun for him. Now, we're
poor insight, poor judgment.
Yeah, and so parenting skills called into question,
right.
And really perhaps a whole indictment of home environment. Heath, there's almost a need we have to try and make sense of this, or to try to come to grips with it. What should we remember? What do you believe the takeaway is from this case and perhaps others, in addition to the psychotropic drugs?
The takeaway is to understand that racism, though we've made progress throughout the United States, it's nevertheless lingers on the contemporary landscape. And it's localized in certain areas more than others. They did a very interesting cyber geography independent research group, studied racial terms that were used in Twitter across the nation. And they were able to track down where it was most prevalent. these Twitters and these racial terms and these racial critiques. And it's interesting, the Carolinas figured very strongly there. North Carolina even has more Ku Klux Klan organizations than South Carolina. Texas has it high, but North Carolina has actually right now 9 organizations, Ku Klux Klan organizations, which makes it the 3rd in the whole nation.
Well, as a native North Carolinian, I find that concerning. But your final thought, Lisa, what do you want to leave people with here? And we have about 20 seconds.
Well, I think that sometimes it takes something bad to happen to make good things happen, and I think that this incident is causing people to look at things differently and maybe make some social changes that may be very relevant and important, and time for it. So I think that hopefully some good will come out of it.
Dr. Lisa Palmer and Dr. Heath King, our thanks to you both on this very difficult subject, and Newsmax Prime will continue after this.